What is this drug? Tamsulosin. The suffix osin indicates it is an alpha blocker, and this tamsulosin is indicated for the treatment of benign prostatic hyperplasia or hypertrophy, commonly known as BPH. In this condition, we can observe enlargement of the prostate gland, resulting in decreased urinary output. So this is the normal prostate gland which flanks the urethra. With normal size of the prostate gland, the urine output is normal. But in the patients with age greater than 60 years, we can observe some prostate enlargement. Particularly, this prostate enlargement is more observed in the patients with age greater than 80 years. So in such conditions, because of prostate enlargement, the urethral pathway is somewhat constricted, so that even by constriction of the bladder, urine cannot be emptied completely, resulting in urinary retention. So in such patients, we can observe increased urinary frequency as well as urgency because the urine is not cleared from the bladder, even by constriction of the bladder, and there is decreased urinary flow. These two conditions result in the incomplete emptying of bladder. So even urinary frequency is increased, but bladder is not completely emptied, resulting in discomfort in the patients. So in such patients, we can observe increased urinary frequency as well as urgency, but urinary output is somewhat reduced. In those patients, tamsulosin can be used, which increase the urinary flow by relaxing the prostate tissue as well as bladder neck muscles, so that urinary flow can be increased. But when this drug is used for BPH, what are the important precautions that should be considered, and what are the side effects that can be observed with this drug? So these things we will discuss in this video. First of all, let us see the precautions of tamsulosin. One of the important precautions of tamsulosin is that this drug can act on the vascular smooth muscle, which is expressed with alpha-1 receptors. These alpha-1 receptors are responsible for vasoconstriction. Now, tamsulosin acts as alpha-1 blocker, so that it blocks the alpha-1 receptors, resulting in vasodilatation. Now, this vasodilatation produces some hypotension and decrease in the blood pressure, which leads to so many side effects. Particularly, this hypotension changes with the posture. That's why it is also called as postural hypotension. So, postural hypotension is one of the important side effects of tamsulosin. In this condition, the blood pressure is not changed with the gravitational pressure and change in the posture, leading to some hypotension. That's why this postural hypotension is also called as orthostatic hypotension. So with the tamsulosin, we can observe decrease in the blood pressure. Particularly, the systolic blood pressure is reduced at least 20 mm of mercury, and diastolic blood pressure is going to be reduced by at least 10 mm of mercury. So when there is a drop in the blood pressure by 20 of systolic blood pressure and 10 of diastolic blood pressure, it can be considered as orthostatic hypotension, which changes with the posture. So tamsulosin produces a postural hypotension, resulting in the various symptoms in the patients. It can produce some lightheadedness because of postural hypotension and dizziness, some reeling sensation, even vertigo can be produced. Patient may have some confused state, and all these conditions may result in the syncope, the falling sensation within the patients. So care should be taken when this postural hypotension is significantly observed in the patients. This is more important in those patients who are driving the vehicles. Otherwise, those patients working with machinery, a caution should be taken to monitor any symptoms of postural hypotension. Similarly, this drug can produce one of the condition, Priapism, which is a very rare condition, which is observed only in 1 patient out of 50,000 patients. Again, this is because of vasodilatation of arteries supplying to the corpus cavernosa. In this condition, there is a persistent erection of penis for greater than 4 hours without any relation with time of intercourse or sexual interaction. And because of this prolonged erection, it may result in some painful erection in the patients. Even this is a rare condition observed with the tamsulosin. But if it is observed, then care should be taken, because if it is untreated, it may lead to some impotence in the patients. Similarly, tamsulosin can be converted into metabolites by cytochrome P450 system. One of the major metabolic pathways is the CYP3A4 enzyme. So many of the drugs are there which are inhibiting the CYP3A4 enzyme activity. For instance, ketoconazole is a strong inhibitor of CYP3A4 enzyme. Thereby it inhibits the metabolism of tamsulosin. When its metabolism is inhibited, its serum levels are increased, resulting in the increased toxic reactions such as significant hypotension in the patients. That's why ketoconazole is contraindicated with tamsulosin. Similarly, if you have the drugs such as erythromycin, can also inhibit the CYP3A4 enzyme activity, but it is a moderate enzyme inhibitor. So when this tamsulosin is combined with erythromycin, caution should be taken to monitor any significant hypotension or toxic reactions of tamsulosin. Another metabolic pathway for tamsulosin is mediated by CYP2D6 enzyme. This is the minor metabolic pathway compared with the CYP3A4 enzyme. So if you have the drugs such as paroxetine, terbinafine, all these drugs are going to inhibit this enzyme activity. So again, these drugs can increase the levels of tamsulosin. That's why these drugs should be carefully combined with tamsulosin. Particularly because of these interactions, when these drugs are co-prescribed with tamsulosin, the low dose of the tamsulosin should be used, and it should be used at 0.4 mg in order to minimize these drug interactions. Another important drug interaction is observed with phosphodiesterase type 5 inhibitors. We have the drugs like sildenafil, tadalafil, vardenafil, avenafil. All these are phosphodiesterase type 5 inhibitors. They are used for treatment of erectile dysfunction as well as pulmonary hypertension. So these drugs mainly produce hypotension as important side effect. So when these drugs are combined with tamsulosin, this hypotensive effect is more pronounced, resulting in severe hypotension, collapse, even coma and death in the patients. So again, care should be taken when this tamsulosin is combined with phosphodiesterase type 5 inhibitors. Similarly, this drug can produce intraoperative floppy iris syndrome IFIS during the cataract surgery. This is not observed in all the patients. Those patients who are undergoing cataract surgery and who are administered with tamsulosin before the surgery, they may have one of the syndrome, intraoperative floppy iris syndrome. Normally during the cataract surgery, the lens is going to be incorporated by a micro incision. So after the incision, the lens is going to be incorporated, and this method is known as phacoemulsification. But for this process, the pupil should be dilated, so proper dilatation of the eye is required. Now, in presence of tamsulosin, we can observe poor pupil dilatation and even meiosis, pupillary constriction, flaccid iris. All these conditions can be observed, which are collectively known as intraoperative floppy iris syndrome. So in such patients, this tamsulosin should be carefully used because it interacts with cataract surgery. What are the side effects? The important side effects of tamsulosin are mainly related with its vasodilatory actions. It can produce the side effects related to CNS such as headache because of cranial vasodilatation, and it can produce some dizziness, lightheadedness, blurred vision, somnolence, drowsiness, as well as it can also produce some disturbance in the sleep resulting in insomnia. All these side effects can be observed with this tamsulosin. Similarly, by acting on the urogenital system, it can produce some abnormal ejaculation. So prolonged erection can be observed, which may lead to some abnormal ejaculation in the patients. It can also affect the respiratory system, resulting in rhinitis, pharyngitis. But apart from these side effects, one of the important side effects of tamsulosin is the hypotension, particularly postural hypotension. And because of this hypotension, it can produce some syncope in the patients, as well as it can also increase the cardiac activity, resulting in palpitations as well as chest pain. But these side effects can be controlled with low dose of tamsulosin. So that's about the precautions, interactions and side effects of tamsulosin. So this drug, tamsulosin, is indicated for the treatment of BPH at 2 doses 0.4 mg as well as 0.8 mg. It is initially started at low doses such as 0.4 mg. But when this drug is given, it can produce some postural hypotension or orthostatic hypotension, resulting in the syncope as well as fainting. So caution should be taken to monitor any symptoms of postural hypotension, and it should be carefully combined with CYP3A4 inhibitors as well as CYP2D6 inhibitors. And when it is combined with phosphodiesterase type 5 inhibitors, it can produce some significant hypotension. During the cataract surgery, it can interact with the procedure and it can produce some intraoperative floppy iris syndrome. And very rarely it can produce some prolonged erection of penis resulting in the priapism. So with these precautions, tamsulosin can be used in the treatment of BPH. So that's for today. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.